Good morning, I'm Rachna. Today here we have with us Dr. Saloni Mistry, who is one of the finest prosthodontists in India and one of the early contributors to the DentistChannel.Online. So ma'am, what would you like to say about magnetic mallets?
Before I begin, Rachna, I would want to say that I am Dr. Saloni Mistry. I head the Department of Prosthodontics at Dr. J.D. Paul Foundation, YMT Dental College. It's a dental school in Navi Mumbai. I run an academia. For the last 23 years, I've been in the teaching profession. It's my passion. I also have a private practice in Goregaon East, in the western suburb of Mumbai. And I'm here at the WIE for the last 3 days to talk about something very innovative. It's a magnetic mallet. Now, magnetic mallet is an innovative tool. It has been collaborated by iFix with OsseoTouch, which is originally based in Italy, and it's a very innovative tool that has to kind of gain momentum in the Indian clinical scenario. Now, all of us have those kind of jitters when we are doing maxillary posterior regions where we have very suboptimal bone levels, we have low sinus floors, we have systemic conditions which are kind of altering the bone conditions, osteoporosis. The Indian clinical scenario has a lot of challenging kind of situations, and as implantologists we got to really choose and pick the tool, the biomaterial, the implant system, the technique that we're using. And about the magnetic mallet, it's something that has kind of given us solutions for these suboptimal bone levels. Now, what is a magnetic mallet? A magnetic mallet is something which absolutely looks like your micromotor. It's your micromotor, but it's like a control unit. It has 4 forces and it's connected to a handpiece, and it has several attachments, which is an osteotome. So it has sequential osteotomes, and it can be used for 1 suboptimal bone levels with no drill protocol. That means there is absolutely no drilling. It's sequential osteotomy in soft bone, because what you want is osteocondensation. What you want is good primary stability. What you want is good bone implant contact and bone area fraction. So that's what we are looking at. The second indication is for indirect sinus slip, that is the transcrestal approach. When you have low sinus floor levels, you want to hit the floor and then you slowly break the sinus floor without altering or perforating the Schneiderian membrane. It's very pristine. So you've got to really worship the Schneiderian membrane. The third indication, you have extraction sockets, and in these extraction sockets you have a huge volume of bone which is like it's just empty, and you want the mallet to go in, condense the bone all over, and you want your placement of your implant with very little of jumping distance. The fourth indication, it can be used beautifully for extraction of root pieces. It works extremely well, and also it can be used for crown removals. Crown removals can be nightmarish for prosthodontists or any clinician, so it works extremely well. There are different attachments of the mallets, and all these different attachments go into that electric motor, and that's how you have now controlled force. How does it work? It works on a tap control, or it works by the hand. The operator itself, himself or herself, can use the tap. You have 1 tap and you have the impulse. The impulse lasts for 80 microseconds, and you have 4 forces. That's 75, 90, 130 and 260. So these forces can be altered according to the bone density. That's very significant the moment you get the tactile feel, because that's how you hold it in the hand, and it's the tactile feel. It progressively goes in 1 mm with every tap. You wait between the 2 taps for 4 to 5 seconds. You allow the bone to expand. You allow the condensation to happen. The bone has the viscoelasticity. So you're going progressively inside. Another very significant factor of this magnetic mallet, now, in age-old times until now, I would say, I'm not talking about, all of us were using compressive osteotomes. That is not the magnetic, but the manual mallets. It's like a chisel and hammer, and you're hammering the osteotome, It's such a crude way, and what happens is the patient is very apprehensive with this uncontrolled force. It has interoperator variability. I would probably have more force, you would have lesser force. I don't have control over the force, I don't have control over the direction. So this kind of force is so uncontrolled with the compressive osteotomes, and what happens is that the patient has that giddiness, headaches, and the patient compliance is so poor because these kind of uncontrolled forces causes movement of the otoliths in the ear canal, and that has been documented as BPVV, that is benign paroxysmal vertigo.
Okay.
Now, all these kind of complications that we face in the maxillary posterior region, where we have to preserve the pristine Schneiderian membrane, we have to break the sinus fold gently, we have to have nice bone implant contact, the BIC, we have to have primary stability. All these are challenges, and that's where the magnetic mallet works. It works as a tool which you use with a lot of scientific knowledge. You've got to understand diagnosis, you've got to understand the feel of your bone, the density of your bone, and then progressively you use the mallet. Now, the basic working of the mallet, as I explained to you, it's on foot control or hand. It goes in 1 mm, you establish the depth, and then you sequentially widen your diameter. It's something like an undersized osteotomy, but a no drill protocol. So what are you doing? You're basically condensing along the wall of the osteotomy, the bone which is compacting along the wall of the osteotomy, down, not just laterally, but apically as well. And that's how the mallet works. Now you can use it specifically for maxillary posteriors as well as for anterior regions where you have softer bones. So we are here to let this magnetic mallet unfold its clinical applications in the Indian scenario, where embracing a new technology takes a little time.
Yes.
We got to really know that where to use it. We got to really have scientific basis. We are surrounded with a lot of, advertising kind of, I would say, enforcements. So here the magnetic mallet is very scientifically based. Where are you going to use it? How are you going to use it? How are you going to control your direction? And that's what is very important for us. It's important that we get it into the Indian scenario to help our patients, to help those patients who probably are going to be wearing cast partial dentures because we are probably scared or we have unpredictable outcomes, and we don't know what are the answer for softer bone levels.
Yes.
So it's important that we collaborate with this technology, we understand the knowledge behind this technology, and use the mallet for the benefit of our patients.
Would you like to share your honest opinion on, are magnetic mallets here to stay?
So magnetic mallet has a lot of clinical indications in suboptimal bone levels, as I already mentioned. Embracing a new technology requires a lot of scientific evidence, research. I personally feel that there has been a lot of documentation of different types of techniques: compressive osteotomes, piezoelectrics, osseodensification, and irregular drills. Magnetic mallet is something that has kind of creeped into suboptimal bone levels, and it's showing the histology and the biomolecular levels where there is no scar tissue. There is nice amount of bone compaction. And all this is very, very significant when we are dealing with suboptimal D3 and D4 bone levels. So yes, I indeed feel that magnetic mallet is here to stay. It is a tool that you must have in your practice, because that's something that you can use in combination with the knowledge of the bone, the knowledge behind the systemic condition of the patient, the knowledge behind what kind of technique you want to use. Is it a immediate placement post extraction? Is it a sinus lift? A very, very safe procedure. Somebody who is beginning cannot be using something which is so uncontrolled. So you want a novice also to learn that some safe tool can guide you millimeter wise to how to do the transcrestal approach. So I am certain that magnetic mallet is here to stay, but yes, it is a tool that you must have in combination to the science of other techniques and the science of bone, and knowing your patient of what is it that is best for your patient.
Okay, thank you so much, ma'am. Thank you for sharing your knowledge with us.
Thank you so much.